Now, did you know that it takes 7 years of training to become a neurosurgeon? Now, that's after 4 years of medical school and 4 years of college. Residents typically spend about 80 hours a week here, and if you do the math, 80 hours a week over 7 years, they are spending a heck of a lot of time here during their training. So after the break, we're going to probably have to sprint to catch up with Dr. Bristol as she's running around the hospital today, seeing patients and performing surgery. But it'll be very interesting and exciting, and we're looking forward to having her.
Where do they get the energy from?
Yeah.
Amazing.
Yeah, you know what, it's interesting. You see these residents training for so long, they have so many hours, and it's such delicate surgery. I just worry, I mean, do they ever get tired?
It actually is amazing, and the residents here are given a, like I said in the tape, their training is really second to none.
Yeah. Thank you, Brad. Well, we're going to head back out to the Barrow Neurological Institute for the 1-year anniversary, apparently, of TopDocs.
And Dr. John Shufeldt has been telling us a little bit about how a resident becomes a neurosurgeon.
Hey, Eric and Frank, how y'all doing?
Great.
I thought I was on Rock and Roll Jeopardy there for a few minutes listening to you guys, trying to guess the names of them myself. Well, we managed to catch up with Dr. Ruth Bristol, a third-year neurosurgical resident at the Barrow Neurological Institute. Ruth, welcome.
Good morning.
So tell us, what possessed you to do 7 years of training after medical school?
It was just something I fell in love with in medical school.
Was it really in medical school, or was it actually even before that?
It was actually medical school. I didn't figure out I wanted to go to medical school until I was in college. And then I went with that, and in medical school I did a rotation on neurosurgery, and I just loved it.
And just shot right up to the top. Now, neurosurgical, as I recall, anyway, back when I did it, neurosurgical residencies are probably the most difficult to get and the most competitive. It's still the same way, I imagine?
It was very challenging. There are a lot of applicants for each spot.
And only 100 spots in the country, you were saying?
About that.
Wow, it's quite a bit more, and actually every other specialty, I think. Tell us, what's a typical day like for you?
This year, I'm coming in at 6 o'clock, meet with the other residents.
Get to sleep in.
Yeah, exactly. You know, it's nice this year.
Right.
We meet with the other residents, go over what happened over the night, and then we go around and see all the intensive care unit patients, and then we go have breakfast. That's one of the perks of this program.
Wow.
We try to have breakfast every day. And then we start the ORs at 7:30, work right through until all the cases are done, and then go home sometime between 6, 8, 10, whenever the work's done.
Well, and now it's 80 hours a week now, or 80 hours a week because of that law that was passed. And that's actually cut down from what it used to be. It used to be quite a bit more than that, wasn't it?
It has. Our program has grown in the past couple of years. We're now up to 14 attendings, and the residents have gone from just 2 per year to now we're alternating 3 and 2 per year, and we hope to go to 3 every year in the near future.
So it's kind of anticipated that the hours will be scaled back?
Well, we're anticipating working out new ways to fit those hours.
To accommodate it?
Yeah.
I asked this before, if you ever figured out exactly what you made hourly, and it's probably too depressing because it's
I don't want to know.
It's right above minimum wage. So,
Exactly.
So when you're here, for example, the other day we caught up with you, how many cases did you do that day?
That day I did 2. I got to do a spine case in the morning,
Right.
and then I did a simpler case in the afternoon.
Is that pretty typical?
It is, although some days, some of the shorter cases we'll do 4 in a day.
Wow.
Just whenever we're ready, just start the next one.
The next case goes. So what advice do you have for somebody who wants to go into the neurological specialties, or actually for a woman who wants to go into medicine or surgery? Any particular?
Stick to what you do well, and just keep at it. And it doesn't necessarily have to be all work related. It can be an outside interest that you have. Just be yourself and work at it.
Maintain some sort of balance.
Yeah.
There, I think that's probably the hardest part in medicine. What's the next year? What's the last part of your year look like, since we're halfway through?
Actually, in the next part of the year, I'm off service for 4 months, where I technically get to work on my own growth and path is what I'm supposed to be doing.
Research project, is that translated?
Yeah.
Very good.
Something like that, or pathology, where we come in and look at slides, and then I'll have even better hours than I have now.
Very good. Well, I won't get to see as much around the hospital, but thanks for being with us. I'm sure this is very inspiring for people who are a few stages of the game behind you and way behind me. Well, Eric and Frank, thanks. Have a great holiday tomorrow.
Thank you. It's been very informative, and
Yeah,
we thank you for that.
fascinating stuff. They work so hard.
Oh, she's a brilliant woman.
Give our best to Dr. Bristol.
We will. Thanks.
Okay, thank you.
All right, thank you so much. And for
the Maricopa Medical Center, and that is where Dr. John Shufeldt is joining us for today's Top Doc segments. Hi, Dr. Shufeldt.
Hey, Marty. Hey, Scott. How you both doing?
Great.
Well, as you know, I'm down here at the Pediatric Emergency Department at Maricopa Medical Center, and the physicians down here are on staff 24 hours a day, 7 days a week. So no matter what happens, they're always there waiting for you. The Pediatric Emergency Department at Maricopa Medical Center is open 24 hours a day, 7 days a week. Dr. Teresa Murdoch is one of 6 full-time board-certified physicians that works in the department. Now, while it may be difficult for some doctors to care for children, it comes easy for Dr. Murdoch.
I love taking care of kids because they don't like to be sick, so it's usually not something they did to themselves on purpose. It's usually some sort of accident or illness, and they're happy to get well, so they're easy to take care of.
On the average day, Dr. Murdoch has to be prepared for anything and everything.
Here at the county hospital, we see pediatric trauma, burn patients, so it's kind of a wide variety. Every day's a different day.
Dr. Murdoch admits the job does have its challenges, but not because of the patients. She says that sometimes it's harder to deal with the parents.
So you kind of have to get their confidence first, and then you have to get the kid's confidence so you can get a good exam, and then do the right thing for the kid and explain to the parent everything that you're going to do.
These doctors keep busy. Throughout the course of the year, the Pediatric Emergency Department at Maricopa Medical Center will see about 23,000 patients. About 20% of those children require continued treatment and are later admitted to the hospital's pediatric floor or even to the pediatric critical care unit.
Now, not only do the physicians here treat patients from birth to 17 years of age, they also care about patients after they leave the center. And coming up in our next segment, we're going to talk to Dr. Teresa Murdoch, one of Arizona's top docs, and see a very innovative program that she actually was instrumental in starting, and it's giving the parents car seats and actually bike helmets for their children when they leave.
Terrific program. I know they do some amazing work down there.
They do.
Doctor, thank you very much. We'll see you in a bit. We want to throw up your website. It's www.aztopdoc.com, and of course you can find out.
Hey, you know what? In our last segment, we showed you what a doctor in the pediatric emergency room down at the Maricopa Medical Center goes through on a daily basis.
Yeah, well, this time we're going to talk to one to find out how they do it day in and day out. And we're going to go back to Dr. John Shufeldt now down at the Maricopa Medical Center. Hey, John.
Hey, Scott. Hey, Marty. How you doing?
Good.
Erica, strong work. I thought you did smashing.
She was great.
She was awesome.
Oh, thank you.
We are back here at the Pediatric Emergency Department at Maricopa Medical Center with one of Arizona's top docs, Dr. Teresa Murdoch. Welcome. Thanks for being on the show. Thanks for coming. Now, besides being a lot younger and better looking than I am, how is our training different? Because you know I practice emergency medicine. What makes us different?
To be a pediatric emergency medicine specialist, you do either a pediatric residency and then another 3 years as a fellowship, or you could do an emergency room residency, then another fellowship, which is 3 years now.
So a total of 6.
6 years to do this.
And I only did 3, so that makes you actually twice as smart as me, which is good for you. Now, how does a pediatric emergency department differ from a regular emergency department? What different capabilities do you have?
The nice thing here is I just get to see pediatric patients from age 0 to 17. We're ready all day long to take care of kids in emergency conditions.
So it's just kid the entire time.
Right.
And now you said before you don't even see adults anymore. It's just straight pediatrics.
Just pediatrics. So the nice thing, everybody that works here is specialized in pediatric emergency medicine. All of our nurses are specialized in pediatric nursing for emergency.
And only four of them in the city, correct?
Exactly.
Wow. Now, you started some really cool things here. One was a car seat program. Tell us about the car seat program.
The car seat program is a grant with Arizona that every child that comes to the emergency department is asked how they came to our emergency department. If they didn't come in a car seat, they're given one. And the big thing to remember is children up to 80 pounds need to be in a child safety restraint, which would be this car seat right here.
So up to 80 pounds, is there an age range as well?
No, because some kids are small. It's a height, 4'9" or 80 pounds.
4'9" or 80 pounds needs to be in a car seat. Now, you were saying when we were just chit-chatting that you saw a bunch of trauma this last weekend, and tell us about that.
Probably saw over 6 pediatric traumas this weekend, and every single one of those kids was ejected from their vehicle. So if they'd taken the time to buckle up their children correctly in a car seat, they wouldn't have been as injured as badly as they were. Wow,
that is mind-boggling and sick. Now, tell us about the bike helmet.
Unfortunately, with our bike helmet policy, if they come in and they've been injured, they get a bike helmet. So it's not preventing injury, but hopefully preventing future injury. They've already been injured if they come in. Anybody's scooter injury, skateboard, bike, they receive a helmet before they're sent home.
Now, just explain to parents and grandparents who are watching. Tell us about RSV. RSV is something that this is the RSV time right now. Give us your expertise on that.
We're going to get into full swing of RSV. It's just a name of a special virus. Adults get it. We just get a little cold, a cough, runny nose. Little kids can get really sick with RSV. Premature babies, anybody with lung problems, cardiac problems. If your child starts breathing really fast, you can see their muscles sinking in their chest, their little nose flaring out on the sides. Those mean your child's in distress and you need to bring them in to be seen.
Very good. Any other take-home points for parents?
The big thing is if you could always watch your kids, but there's no way you can watch your kids if you've got more than one all the time. So safety preventions is what you need to do. Safety-proof your house. Make sure you have a pool or a fence around your pool. Buckle your children up in your car seats.
Right.
Make sure they wear their helmets.
Very good. Well, Dr. Murdoch, thank you very much. I had a very great time talking with you. Marty and Scott, there you have it from the Pediatric Emergency Center at Maricopa Medical Center.
That is excellent. Hey, I wanted to ask you a kind of a personal question. I know they have a helipad down there so you can just land with your helicopter?
Every time you get me. No, I actually had to drive in the pedestrian way this time.
Oh, man.
Nice.
Nice job out there. Thank you very much, Dr. Shufeldt.
All right.
Hey, and in case you want to check out any more information about our Top Doc segments, any physicians you see on the show, you can check it out at www.az. I never have reason to go and seek out a pediatric orthopedist, but should the need arise, there happens to be 4 right here in Phoenix.
On today's Top Doc segment, Dr. John Shufeldt will be introducing us to Dr. Greg Haraski, a Phoenix area pediatric orthopedist and Top Doc. Dr. Shufeldt, how are you doing today?
Hey, Scott. Hey, Marty. How are you?
Did I get his name right? Haraski?
You got it perfect.
Oh,
and you were probably a little too old for Dr. Haraski's services, but he takes care of a lot of children. And as I know you both are aware, children can be difficult to begin with, but boy, when they're patients, a lot of things play into their care.
Dr. Greg Haraski is one of a select few pediatric orthopedic surgeons here in the Phoenix area. As a pediatric orthopedist, Dr. Haraski treats patients from birth to age 16 years old, or even longer if they have any congenital or developmental abnormalities related to their bones.
And then a whole spectrum as I treat kids from basically age 0 through 16 of anything possibly that you can imagine a child doing that involves physical activity is unfortunately in some instances an opportunity for children to injure themselves, and that runs the gamut of toddlers taking a slip and fall on kitchen tile to teenagers getting airborne at the skate park and taking an unfortunate land.
Today, Dr. Haraski is operating on a young athlete who was diagnosed with a slipped capital femoral epiphysis. This condition typically occurs in young patients who have a large body habitus. A slipped capital femoral epiphysis occurs when the head of the femur or thigh bone slips or shifts at its growth plate. This causes the patient to have pain in the hip, knee, or thigh.
And that young man had actually, he's very athletically active, had been playing football this past fall and was into his basketball season this winter, was having continual pain to his thigh and to the knee region predominantly, and his pediatrician was savvy enough to suspect that there might be something going on with the hip joint and obtained a hip x-ray which showed this condition, and because of its identification, the next step was surgical treatment to prevent this process from worsening or becoming more aggravated.
Dr. Haraski finds the care of pediatric patients to be very rewarding. However, there are some challenges.
Treating children and adolescents, you're not just treating the child, but also their parents, and sometimes their siblings get involved and are upset because big sis or little brother are injured or have some condition that requires significant medical treatment. And there also are many other gamuts to the recovery, including coaches, teachers, gymnastic mentors, dance instructors that have to be informed of what's going on with the child and where their next step is.
In the course of a typical week, Dr. Haraski sees many injuries that he feels are very preventable. He says that some of the most common injuries occur while children are playing, for example, unsupervised in a backyard trampoline, or while rollerblading or skateboarding, slipping and falling and landing directly on their elbow, causing it to shatter. Despite the challenges, Dr. Haraski finds the practice of pediatric orthopedics to be very rewarding.
Well, I think it's the most exciting career that I can imagine within medicine, in that irregardless of a problem that a patient presents with to my practice, whether it's a newborn with a hip dysplasia or congenital hip problem, or the 12-year-old with a fracture from the skate park, it's just very exciting to help children and their families on, whether it's helping a little baby develop normally or helping a adolescent get back into the swing of things and into their regular activity level.